This podcast is for educational and entertainment purposes only. It does not provide medical, psychiatric, or mental health advice and is not a substitute for professional care. Any patient stories discussed are fictionalized, composite, or anonymized to protect privacy. The views expressed are our own and do not represent employers, organizations, or licensing boards. If you are experiencing a mental health crisis, please contact local emergency services or a crisis hotline. With that out of the way, welcome to Dead Inside and Board Certified. What's up, guys? It's Morgan.
I'm Dagny.
And today we are going to talk about trauma and how you don't learn in nursing school how to carry this shit home with you.
Yeah. I guess let's start with, or I want to start with when I was fresh out of nursing school and, I didn't realize, at the time I had 2 little kids. I was married, still married, same children. And I didn't realize this, I think, how overtouched I was.
Mm-hmm.
How when I'd come home, I didn't want to be talked to. I didn't want to be touched. I could not handle anyone needing me.
Yeah, I feel like I never expected that. Like, I was so excited to get done with nursing school and live my dream and my passion. And then I realized there's so much shit that I'm going to see at the hospital, and there's so much shit that I'm going to deal with. And there's all of the, not just the patients, but the administration, and all of that stuff just builds up and builds up. And then I have to come home and tell people how my day is.
Oh my God. And you don't realize, I think it also took a while for me to realize how different our jobs were
100%.
until you go to dinner with friends or with people and they ask about your job and you start to talk about it and you get the looks. You're just
it's like my fiance, how was your day, honey? Like, how was your day? It's fine. Tell me about it. You don't want me to tell you about it because you don't understand.
No.
Like, I just held a mother who threw herself on the ground because her kid is dead. Like, how do you have those conversations with family?
Yeah.
And I think this is a lot of what we're trying to address today, is more so, I think, for the healthcare providers, but it is also pertinent for patients because our patients have gone through traumatic experiences that maybe we haven't, and how we handle trauma and how you can't out-medicate it.
No, there's no out medicating. And I think, this goes for, obviously healthcare providers, nurses, EMT, firefighters, freaking police. Sometimes I feel like EMT and police have it way worse than we ever did.
Yeah.
Because they don't have the meds. They, granted, as healthcare providers, we've tackled many a naked person. But I feel like police and EMT,
yeah,
at least those naked people might have had guns.
Our naked people are confined to a building. Their naked people, if there's any EMTs, police, y'all's naked people are out in the community. So I empathize. There's so many people. And I think I'll pull it up later and read it, but I did a speech at a trauma symposium recently. And it was all these trauma professionals coming to learn about trauma and taking care of trauma patients and all the blood, sweat, and all that good, gory stuff. And then they asked me to give a speech on mental health. And I'm like, at a trauma symposium, when I tell you the amount of nurses that came up to me afterwards crying, I had someone send me this huge long email about her EMT husband who committed suicide because of the trauma, not having anywhere to cope. People need to understand that we get it, and that's what we're here for. And so I think sharing our experiences, sharing the resources, and having these open conversations about the bullshit we deal with and the bullshit EMTs and police and everybody deal with.
I mean, and I want to add, even correctional officers, that's them.
Oh, yeah.
I mean, there's just, and, I'm not going to say that, we have it figured out for the trauma, on how to fix it, because there isn't. I think today maybe just bringing awareness to it. Yeah. And for some of you assholes that be out there in the, I worked ER, I worked on, med surg. I've worked all different places, but especially in the ER, yelling at me because I haven't been to your room in 30 minutes. Mind you, I just had to do CPR. I'm covered in sweat. I will never forget the time I went to a patient's room. I'm covered in blood. Like I thought I got it all off my face and I looked in the mirror. I apparently did not. And they're yelling at me because they've been there for so long. And I'm like, bro, you are walking and talking and breathing just fucking fine.
And I don't think people get that because I empathize that you have a medical need right now. I empathize that you're worried about your loved one. But screaming and yelling at me, one, is not going to make me want to help you any fucking faster. But you don't know where we just came from. And I don't know where you just came from either. I don't know what you've been through. But you don't know that I just called time of death on an infant. You don't know that I just spent the last hour trying to save somebody's life that
you don't know I just spent the last hour getting my ass kicked by Dingleberry over here.
Literally getting physically assaulted or screamed and yelled at. Yeah. There's just so many things that I think we need to bring awareness to, especially for our healthcare workers. Yeah. And if there's patients listening too, hopefully that brings you a little more insight as to what we're dealing with and why we're not helping you so fast or why we may seem a little standoffish sometimes.
And just try and be nicer.
Yeah.
Like we know you're hurt and we don't, we're not going to hold your anger or you yelling at us against you. Like we understand you're hurt. We understand whatever's going on is scary. Like we get that.
But if I'm doing CPR and you walk up to me mid-code and say, "Where's my warm blanket?" Get the out. Yeah. Like do not walk in this room while I'm actively compressing and being like, "We're still waiting for a warm blanket."
Oh my God. Or a sandwich.
I understand that and I'll bring you 3 when I'm done, but this is not the time.
And sidebar, the sweeter you are to your nurse, the more sandwiches you'll get.
I might bring you mayonnaise.
I might even toast it for you.
You had a toaster?
We did, yeah.
We don't have that. Yeah.
Toasted PB&Js I would eat at 3 a.m.
Police theft. We've all done it.
And I worked PZR for a while, and they had the best snacks. We would have Cheez-Its.
See, I don't think we could trust our emergency department with all of those snacks because I'm eating them. I know everybody else would. We don't have that kind of stuff, but I supply the candy for the candy drawer at work, and those fools will have that gone in 2 days.
Yeah, see, I never, no. But
that's how we deal with trauma snacks.
Candy, yeah. But no, I think, what was your first, like, what is the first experience you had out of orientation as a brand new nurse that sticks with your brain? That just sticks with you and will stick with you forever. It doesn't have to be traumatic in the sense of like, making you want to sob, but just experience that you'll never forget.
I think for me, it was my first day out of orientation and my first job was a cardiac ICU, which I was so excited for. Keep in mind, I wanted to do labor and delivery, life and happiness, and that was not for me. I didn't even make it out of orientation with that bitch, but I worked in a cardiac ICU and my first patient by myself, these 50s, walking, talking, came in, and then all of a sudden, dead, spewing blood out of his mouth, fell backwards, had a ruptured varice. And we had no idea. And so I'm a brand new nurse.
Those are fast.
First day out of orientation, I'm standing there physically shaking. I remember standing right next to the cart, physically shaking. And I knew what I needed to do. And I did. And I got the help and everything. But I was really struggling with that because to me, as a nursing student, death was supposed to be predictable. Like, you're like, oh, this person's sick, they're dying. No, this person literally dropped dead in front of me and I had no idea. And so I was kind of struggling with that after the fact because it was my first day alone. And I remember the charge nurse at the time was like, "You're going to be too fucking sensitive for this job if you're getting emotional after one death," and then walked away. Basically told me to control myself.
Yeah.
I'm not standing there sobbing, but like, I just wanted somebody to talk to. Like, how did that just happen?
I've heard ICU nurses eat their young.
They do.
Big time.
And guess what? I was a damn good ICU nurse. And I always tell my students, you're allowed to have feelings and you shouldn't bottle them up.
Yeah.
But in that moment, for me, that was so fucking traumatic because, well, one, it's my first patient ever on my own. And he's dead. And I'm like, what did I do? What did I not catch? What did I miss? Nothing. In the end, there was nothing I could have done. But not having anyone to talk to about that or to decompress or just... Because then you expect me to clean the room, clean the blood off of me and the floor and just move on to the next patient? Like, No, I needed somebody in that moment.
Yeah, the sudden deaths, unpredictable ones fucking get you. Because you're just like, did I do something wrong? Like, did I miss something? What? Like, all these things run through your brain, and nobody, they're getting better now, I will say. Like, we do have, I can't remember what those talks are called. Debriefs.
Yes. Yeah.
So it is getting better, but yeah, no,
And I think we're also raising more awareness for mental health, and the hospitals are having.
I feel like our nurses are fighting back. Like, they're not putting up with this anymore. Absolutely. Like, the unsafe ratios. Like, I remember I was a newer grad, worked on, I did neuro, like the stroke floor, which ended up being like neuro slash gero psych. It was the worst experience of my life. Anyway, and we were short staffed, and they wanted me to take 8 patients. Mind you, on the neuro floor, like, half of them were stroked out, and like half their bodies didn't work, and they were full lipped. And I was like, no. And they're like, well, you have to. I was like, I'm not. Like,
I don't have to do shit.
8 patients.
What if we bribe you with a pizza party?
Well, or they give the pizza party to day shift, and here we get the leftovers.
Here's your crust. Now take 8 patients that are a full lift.
Seriously. And like, also for all of you people out there, night shift nurses need donuts too.
It's true.
Like, we never got.
I mean, look at me. I obviously need a donut.
Or candy. Like, I don't understand. I was so upset when I realized day shift nurses got all the goodies.
I will say because I've always done night shift. I've been night shift for the last 10 years. I still am in the ER. Some of the families, though, like, I know we're talking about all the negative shit right now, but some of the families that go out of their way to make sure you feel appreciated, it's a dime. Like, it's not often, but I still remember some of those families where it's like they want you to know how much you meant to them, even if their loved one is dead, and just like making you feel appreciated. And
I'll cry more at that.
Every time. Like, it doesn't have to be a physical. It could just be like, I got a card in the mail. This one, if we want to talk about trauma, this one, I still have the card at my house. This death probably happened 8 years ago. I was working in a peds ICU. Son died. It was my first pediatric death because I wasn't supposed to be working in a peds ICU. It was an adult ICU, but they like took some older kids. And unfortunately, the patient had an asthma attack. They couldn't tube him. They couldn't crike him. He died. And it was just emotional for me. But I snuck the mom in because I let her stay longer than I should have, and just like made sure she was okay in a way that I would have wanted somebody to be there for me. She sent me a card in the mail. Like, your child just died and you took the time to find out where I live, which is fine, and send me a card just to say thank you.
Yeah.
That shit tears me up.
Dude, I'll sob.
It tears me up. And
every time.
But what do you feel like was the case for you where you first realized, like, I'm not going to sleep after this shit? What did I sign up for?
I don't know. I think I've got some traumatic ones, but
we could write a book.
Yeah, I think it's some of the breaking the news ones of, like, I had a special needs. He was probably 30. I was hospitalist at the time, and I'd been with him several days, and he'd do okay, and then he wouldn't do okay, and it got to the point where he was about to get tubed. There just wasn't quality of life after that, and I had to break it to mom at like 2 o'clock in the morning, and she's sobbing, and I'm trying not to sob, and I'm one of those empathetic criers. Like, if you cry, I'm crying,
and that's okay.
It's okay, but I don't love it about myself. So, like,
and that is okay. Feel your feels, but
yeah. So she's sobbing. I'm sobbing because I bonded with this guy. Like, he was super sweet. That was probably one of the most difficult ones where I was like, oh man.
Yeah.
And I was comfort care queen. Like, as a hospitalist, like, I was, hey, when are we having this discussion? Because I'm a huge advocate for dignity and death. And,
Yes.
you know, like, what are we doing? What are we doing to Mima here? Like, there is no quality of care after this. And sorry, Valkyrie here is just going to town on her.
She'll be fine.
I'm all about having those conversations. I'm all about like what's the goal here? And I like to have that conversation early. So like those were fine, but man, that one got me.
How do you feel like you handle those conversations though when you've got all this medical knowledge and you know what needs to happen when the family just is not getting it?
I get you just tell them the truth. That's all. With my comfort care discussions, I just tell them the truth. I say, look, you know, the likelihood of your loved one recovering from this and having a meaningful life is very minimal. Or especially, you know, your dementia patients who like barely know their name, barely know their family. And you know, they want me to intubate and tube and CPR, and I'm like, you know, if I CPR on grandma here, like I'm cracking like multiple ribs, like this is not going to end well. And so I just try and be honest with them.
And I think when you say meaningful life, that's very subjective. And getting them to be like, meaningful life, like, would they want to live on this machine forever?
Well, and not even that. Like, it's also a conversation of like some of the surgeries. Like when I would talk to some of my hip replacements, I'd be like, okay, you talk to the orthopedic surgeon. Okay, cool. Let's talk about recovery. Did they talk to you about that? Like how do you handle pain? Because this is very painful and it's really hard work. And you know, some of those 90-year-olds are like, yeah, I don't want to do that. Like I'm exhausted already. Like I don't, and I'd be like, okay, then maybe this isn't for you because sometimes, you know, while a hip replacement or whatever surgery can give them a longer and fuller life, I feel like they don't talk about the work that has to be put in by the patient and if they're ready to do that work. And it's okay
if they even want to.
it is okay if you don't want to. So that was a lot of other conversations.
Yeah.
You know, that I would have a lot.
But when you had that conversation, like you bond with that patient, you have to talk with their family and have that conversation of like, I'm giving you the medical input here, but I also will relate it back. Like if this were my loved one, here's what I'm doing. So you're having that conversation with them. You give them the worst news of their life. Then what? You leave the room.
Just
you crush their, like, say you have the patient that does pass and it's like you're there for them, your loved one has died, you still have a job to do, you still have all these other patients to go see. So then how do you turn that off to go see this new patient?
Well, to me, I felt like in the real rough situations, I'll sit with them. I'll sit with the family because sometimes, you know, if someone else is dying, obviously I'm going to run and go do that. But no, if no one, like, and that's how I've apparently just lived life at this point. Like, if you're not dying, I'll get there when I get there. Or it's not that big of a deal. Nobody's dead. And so I found just sitting in that discomfort with them and just sitting there. Not only I feel like helps the family, but helps me. Because those feelings are uncomfortable. And sometimes I think we just have to sit in them a little bit. And I think that helps. I think afterwards, coping with that and just going to the next one. I mean, you know, I feel like we're all wired to do what needs done. To like, and I hate to say this, but to like just push it the fuck down and just hurry up and go.
To normalize it. Like, this is what I signed up for, moving on.
I don't even know if you normalize it. I think you just push it down and be like, I'll deal with that later. Like, we'll revisit that eventually.
But then do you? No, I just drink a lot of caffeine and have insanely dark humor.
Yeah, I mean, usually if the nights were real rough, I would go to like Casey's and grab. I don't drink very, like, I'm not a big drinker, never have been, but I'll go and grab like a alcoholic beverage at, I remember like 7:30, 8 a.m. at Casey's.
Oh yeah.
And just looking ragged as fuck, probably blood on me.
Get me a mimosa and just sit in my hot tub and just stare at the wall and just self-care.
Yeah, literally self-care.
But have you started noticing, I mean, I guess not so much now, but that when you were working in those jobs, and I still do work in the ER also, did you start noticing the signs of burnout at home?
Yeah. Oh yeah. Like I was saying before, it was the like coming home to my kids and my husband and just being like, don't talk to me.
Yeah.
Don't touch me. Don't talk to me. Don't need me. And I'm like, a big reason I went back to nurse practitioner school. It was hard. It was miserable. It was hell. But that to me was like, this is not good.
And I also noticed that I started struggling before I started working on, processing my own stuff, dealing with normal life stuff. Like my fiance or a family member wants to tell me I had a rough day at work, the printer stopped working and I couldn't give my presentation or whatever it may be. And in my
And
head,
you're just like, but did someone die?
and I'm like, if that's the worst thing that happens to you, like in my head, it became a competition. I'm like, well, don't be that bitch. But it's like, I realized I have never processed the shit that I'm going through. And I don't think anybody's ever going to understand it anyway. But that doesn't mean like I can't listen to your problems. I was just really struggling to be like, your normal life bullshit doesn't matter. There's people dying, but it does. And so I feel like there was just a lot of emotional blunting there that I had to figure out how to get through. And I mean, again, this episode isn't about treating burnout. It's more about identifying it. But like she said, don't talk to me. Don't ask me what's for dinner. Don't ask me how my day was. That
just on it just was like, do not need anything from me because it got better as I will say when I became a hospitalist, things got better.
Yeah.
It was really bad at like really, really bad.
But those are where we have those conversations. Like you have to recognize what you need. I've recognized like I need 15 minutes of alone time.
Yeah, that and see, I didn't recognize those things, and yeah, it sucked.
But I feel like a lot of people, we mentioned neither of us are really big drinkers, but a lot of people will turn to something, alcohol, pills,
oh my
something.
God, the amount of nurses I knew that ended up with an addiction or like especially ER, like they'd go out and drink after a tough shift. And I got a family history of like issues with alcoholism, so that just was never. And I was also the weird person who had like a husband and kids, so I was like, nah, bro, like I just want to go home.
Right.
Like I need to go home. I'm exhausted. I have to get up and like get my kids off the bus. So that was, but yeah, the amount of nurses you see with addiction, with horrible coping mechanisms, horrible relationships. I mean, it was.
I feel like that too, though, is they're looking for a solution because how else do we normalize all this? It's like we deal with so much in healthcare, EMTs, cops, firefighters, everybody. A lot of patients come to us and are like, fix this.
Yeah.
What medicine can I take for this? And again, we're not necessarily talking about the treatments today, but how do you approach that when you've got somebody coming to you? It's like, I've got all this traumatic shit in my life. Maybe it has to do with assault. Maybe it has to do with relationships or their job, not just healthcare people, but that come to you and it's like, what do I do? Because meds are only going to help your symptoms. They're not going to fix your shitty boyfriend. They're not going to fix your job. They're not going to take away the
amount
abuse.
Of times I've had to tell patients now at the practice, I think you need to quit your job. Like it is real. Like just, I think we need, and for some people that's not an option. And I obviously understand that, but like, okay, let's put our effort into finding a new job. But the other thing I think is really educating on honestly everyone on like when you're starting to get burnout and like recognizing, we all hear this work-life balance bullshit. And I know in healthcare that's kind of a nightmare, but also I think it's recognizing like I'm not doing well and I need to step the fuck back.
Or I'm going to continue not doing well.
Yeah.
And then what happens?
Yeah.
You explode.
Yeah. Then you end up getting divorced or like having some crazy midlife crisis or end up on drugs, like,
or all of the above.
Yeah, all of those, making real poor choices. So yeah, I think it's recognizing the burnout.
Yeah.
And having fucking seriously, having managers, having fucking hospital administration, doctors, people not just recognize it, but are like, yeah, absolutely. I see you're struggling. Take some time off. Instead of penalizing it, like, no, 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 no. Like, we're going to be short staffed today. How dare you? Like, you're just going to screw. Because I feel like as nurses and healthcare providers to some extent, but definitely as a nurse, you feel guilt with like, oh, if I call off today, what are they going to do? Like, everybody's going to be short. Like, if I call off, like, what's going to happen to the unit? Like, to the point where you're coming to work sick, you're coming to work in like super unsafe conditions with the weather, like.
But who's thinking about you in that moment?
Yeah, nobody.
I feel like the system kind of wants the throughput. They're like, get in, get out, get all these patients, but it's like, who's taking care of you?
Oh yeah.
And you've got to be able to recognize your symptoms of burnout, patients that we see, because I feel like we see a lot of patients where I can't medicate that. I cannot medicate what you're going through. Medicine's not going to fix it. What can we do for this person?
Yeah. And I think a lot of it is like recognizing when you're overwhelmed, overstimulated, burning out, and like learning things to bring you down. Like, if I get too overwhelmed, I hermit and like really pull back from people. And I'm still trying to figure out things that help me, but definitely I'm a big reader, love to read.
I think that is a very important area too, is what self-care looks like. Because we all talk about like, you have to take care of you. That's not the same for you, me, for the patients that we see. Like, self-care can be your dark humor. Self-care can be therapy. Self-care can be reading and secluding, but like making sure that you're okay is so important, because we deal with some shit.
Yeah, too much shit, man.
We deal with a lot of shit. And without
like, there's like in this, like there is just like hearing some of the trauma from my patients. Like, there are times where like I just go home and I'm like, fuck. Like, nothing I've ever experienced in life is bad.
But do you feel like in those situations though, you're like, what do I do? Do you ever do you ever feel there's a pressure like, here, take this medicine? Like,
no, not necessarily medicine, but like sometimes I'll hear some shit and I'm like,
yeah,
how are you still here? Like,
thank God you are.
Thank God you are, but please, like, a lot of it's therapy. A lot of it is like looking at like some of the circumstances they're currently in. And a lot of, and like, as much as I hate to say it, sometimes I feel like it is compartmentalizing, because like there is some trauma. That is just so fucked up. You're never going to be able, I just don't, and I could be wrong and, come after me, but I feel like there are some things, especially like some like combat military vets. Like, there is some shit that just can't be let out. And there are some things that I think some trauma you just have to learn to coexist with.
And that's what PTSD is, post-traumatic stress disorder. That's when you have an improper coping with something that should be not easy to cope with, that you learn to live with and you learn. So I feel like for us, a lot of healthcare workers do have PTSD, but a lot of us learn that might be dealing with it, getting rid of it, and not thinking about it again. But it's when it's like you can't deal with it. That's when the PTSD comes into play. And I think we have a lot of patients that, or, just healthcare workers listening, that learning how to cope with it, step one.
Yeah. And I think, honestly, step one is like, especially as healthcare workers, is sitting in those uncomfortable feelings for a little bit.
100%.
And,
because I feel like healthcare is training us, like, dissociate, be professional, move on. You're not a robot. Like, you're allowed to have fucking feelings.
That shit's gonna come out. It's going to come out somewhere. It's going to come out in nightmares. It's going to come out in irresponsible behaviors. It's going to come out
snapping on your next patient. Like,
it'll come out. It's going to come back.
Yeah.
And so I think that, and sometimes just putting words to it too. Like, there is no medication for PTSD, but sometimes just saying what happened is, and
name the trauma,
and like, having someone be like, yeah, that's fucking traumatic, can help.
And I'm not offering you a solution. I'm listening and being like,
I'm just going to sit here with you, because
that's terrible. Let's talk about it.
Yeah.
Because
if you don't want to talk about it, that's okay. But eventually, maybe a little
Yeah.
bit.
Yeah.
But
I mean, meds can help, but I feel like they're not magic erasers. They're not going to be like,
no,
let's get rid of this trauma.
trauma is it's a lifelong battle. It is a lifelong battle that
Yeah.
and people get weird from it.
Yeah. So I feel like you got to keep it real with yourself, keep it real with the people around you, reach out if you do need help, but also you've got to do the work. You've got to be able to recognize that you need.
Well, and that's the thing with any psychiatric care. Like, I can't help you if you don't even want to help yourself.
Yeah.
Like, and that's where it's at. And I've had patients where I've had to tell them, like, hey, like, I don't feel like you're ready for this. And that's okay.
Yeah.
But come back when you're ready, because I don't think anything I'm doing is going to help you. And I don't think that, and honestly, like, I don't think you want the help right now. Like, especially when you see someone dragging like their spouse or a kid, it's like, okay, well, you dragging them in isn't going to make them take their medication.
No.
Like, it's not going to make them.
We can't.
Yeah, it's not going to make them open up.
Let's end on a positive note.
Or maybe we'll laugh through like how
some of our bullshit.
I'll never forget one of mine that stuck with me. Brand new nurse, finished orientation, had to put a catheter in an older lady. And at this point, I'm somewhat familiar with female anatomy, but let's get it real here. Everybody's anatomy is different. No two females' anatomy looks alike.
No, they're like snowflakes.
Yeah, it's a snowflake. And so I'm down there sweating because I'm taking forever, panicking because I can't. I'm like just struggling. And this lady, older woman, looks at me and is like, take as long as you want. I haven't had anyone touch me like that in years. And I turn beet red.
You're like, gotta go.
Like my CNA is in there like trying not to laugh, and I, yeah, it's funny. But this lady did not, like, she was dead serious. I'm beet red, like feeling like I'm failing at life. Finally get it, but she, when I got, the catheter in afterwards, she's like, sweetheart, that was wonderful.
I mean, cute old lady, but
she was not demented either.
I swear, they never are, the ones that say this kind of shit.
And then PSA to all old men out there, we do not want to see your wiener.
That was literally what I was just going to say. I had a patient, so I was going in to help this patient. Brian, if you're listening, God love you. This was the CNA that I was working with at the time. Brian is as gay as the day is long. That is pertinent to this story. I am not. But I am head to toe covered in tattoos. And it was during COVID, so I had all the gear on. And we go into this guy's room, and he's in bib overalls, this big, burly farmer dude. And I took off my jacket like I was taking care of him, and he wanted me to help him put his penis in a urinal. This man is 400 pounds. He has an innie. Sir, you don't have a penis anymore. Like, I would have to push it in for it to pop out.
Oh, not just you. You need four people to push around.
But then I took off my jacket, and he saw that I was covered in tattoos, and so it's me in there, and Brian had just come in, who hadn't spoke yet, so the patient was unaware of him being a very flamboyant gay, and he said, I don't want none of them lesbians touching me. Get away from me. I'm not a lesbian, but he saw the tattoos, and then he said, I don't want you lesbians looking at my dick. And Brian looks, he's like, sir, we would have to be able to find your dick first. And the man was just beside himself. Were you trying to hit on me until you thought I was a lesbian? And then you're like, don't touch my penis? Sir, I didn't want to touch your penis. If you needed my help, I would help you, but
we never do. We never, ever, ever do. And why is it the ones with the innies that have all, like, that are the biggest assholes?
I know why. Because they haven't seen their dick in years.
They're trying to give me instructions on how to do it. And I'm like, sir, when was the last time you did it? You don't know. Please be quiet up there.
Like, be respectful. But
like, be respectful. And then let's go on a tangent on that. The amount of times I have had men, older men, younger men, whatever, tell me, you'd be so much prettier if you
didn't have tattoos,
if you didn't have that crap in your face, if you were sweeter. And I'm just like, I'm married. I don't care. I don't care what you have to say. I don't care. Like,
why are you hitting on me?
Yeah. Like, why? A, B, like, don't worry, again, I already found a man who wanted me. So don't worry about it.
Yeah, I feel like the trauma doesn't just stem from like, oh my God, sad, gory things we see. It's also like the emotional shit that you have to deal with and the shit that people say to you. And it's like, sometimes it's funny. A dude looked at me one time and was like, you could play for the fucking Bears because you look like a linebacker. And I said, you know what? That's a creative way of calling me fat. And that made me laugh. That was funny.
Yeah, sometimes.
That was funny.
I don't have.
He thought I could fight. So.
I don't have any good ones of where they were making. Yeah, I don't have any like unique making fun. I did have one where this guy kept trying to propose to me.
Perfect.
And I was like, no, sir. No, sir. I'm married. No, sir. No, sir. No, sir. And then his wife comes into the room and tries to fight me. And I'm like, I grab one of the other nurses, a male nurse, and was like, switch me.
You fight him. I can't.
And I like tried to hide from this one because she was coming out into like the nurses station screaming, you know, where's that bitch? And I'm just like, ma'am, I want nothing to do with any of this. Like I'm uncomfortable. Your husband made me uncomfortable. Like what?
Yeah.
Like it but I will say I do feel like hospitals are getting better.
100%.
Like, you know, there is like, I do love seeing the like, don't beat our nurses signs everywhere. Like, we won't tolerate it. Which
yeah. I stand by that.
100%. I will say though, the first time I had to take that, like, I don't know what they label it as now, but like the self-defense class on how to
CPI,
how to defend yourself against patients.
I'm not doing that. I know how. I'm not doing it.
I about died. I was like, wait, what?
Sir, please hand me your knife. Like, no, I'm getting out of here.
We had the ones of like how to get out of chokeholds and like how to like, you know, smack them or the right way. And I was like, what is happening here? Like, first I wasn't allowed to do anything about this, and now you're telling me to beat them? Like,
okay. All right. I guess I have permission now.
It was like, once they got to like how to disarm someone with a gun, I was like,
I've left at that point.
Yeah, I just sat there and I was like, wait, am I like I'm the nurse. Like, what do you mean I have to learn how to disarm someone with a gun? Like
the shit we deal with.
I definitely would love to hear some of y'all's fucked up traumatic
Please message me here, TikTok, YouTube, wherever you see this. I want to make a compilation of everybody's bullshit crazy stories, whether it's funny or maybe even it's traumatic and it just feels good for you to share it with somebody. Please send it my way. Message me, message the TikTok page, or
because we're here, man. We're here to provide, like, we'll listen.
We'll laugh with you, or we'll just be a listening ear.
Yeah.
If it's not so funny. But that is it for today's episode of Dead Inside and Board Certified. Drink your water. Don't text your ex.
Yeah.
We'll see you next episode.
Pretend the vodka's water.
That's fine. That works too. As long as you follow and subscribe.
Bye.